Hello everyone, my name is Kenji C. Lagunde from BSN1 11M, and for today's video, I'm going to assess the abdomen. Assessing the abdomen consists of inspection, auscultation, precaution, and palpation. The physical examination of the abdomen is the key step of evaluating abdominal complaints such as pain, distensions, and large organs or masses. Prior to the conduct of the procedure, first thing to do is to review the client's medical history. Next thing is to prepare the necessary things needed: the tape measure, ruler, and the stethoscope. Now, before we start, perform hand hygiene. Good morning, sir. My name is Kenji Silagunde from BSN1 11M, and today I will be your student nurse. So, sir, can I look at your wristband? Can you please state your name,
My name is Merjan Dumdum.
your birthday?
My birthday is February 23, 2003.
Okay, thank you. What do you want me to call you, sir?
Just call me Bernard.
Okay, Sir Bernard. Now I will be assessing your abdomen, which means I'll have to expose your abdomen. I'll have to listen to your bowel sounds and also feel your internal organs. Will that be alright to you, sir?
Yes, of course.
So, Sir Bernard, is it okay for you that I will close the door so that no one from the outside will be able to disturb us while doing our assessment?
Yes.
Okay. So before we start, I encourage you to void first. So it will be much comfortable for you while doing our assessment, okay?
Okay.
Ensure that the client's bladder emptied his bladder prior to the conduct of the procedure, because a full bladder can make the examination uncomfortable, and it can reduce the accuracy of the fundal height measurement. And now, position the client in supine position with arms folded over his chest or butt just lying at his side. And place a pillow underneath the patient's knees. Sir, can you please remove your shirt? So you can now like. So, sir, do you feel any pain in your abdomen?
No.
Okay, so I'll begin inspecting your abdomen first. Begin the inspection of the abdomen skin characteristics. Assess for abdominal skin temperature, color, note for any vascularities, stray or stretch marks, and also note for any scars and lesions or lashes.
Check lang. Check lang. Check. Gusto mo dito. Sure. Okay. Let's check lang. Malapit na ako.
While the patient lies in the supine on the bed, sit aside the client and look across the abdomen at a level slightly higher than the patient's abdomen. Stand at the foot of the bed and observe the abdominal symmetry.
Check tayo.
So the abdomen is normally flat, rounded, or scaffold. It should be evenly rounded and symmetrical. So while doing the inspection, and also observe the abdominal respiratory movements, aortic pulsation, and peristalsis. Inspect the abdominal girth. Measure the patient's abdominal girth by placing a measuring tape around the patient's abdomen at the level of the umbilicus. So sir, can you please stand up for me? Remove the gown, please.
Thank you. Two. Tapos three. Tapos hindi ko kita ka. Bawa kami.
Okay. Can you please wear the gown?
Okay.
And you can go back to the bed. The next step I'm going to do is to auscultate for vowel sounds. Use the microscope. Next thing to do is to auscultate for venous hum. Use the bell of the stethoscope. Next is to auscultate for friction knob over the liver and spleen. Use the diaphragm. Percussion. Percuss for tone. Do this 2 times lightly, then harder. Percuss the spad or height of the liver by determining its lower and upper border, then mark. Assess the descent of the liver. Inhale, exhale, and hold, then percuss and mark. Can you please inhale, exhale, hold your breath, please. Can you please inhale, exhale, hold your breath. Can you please inhale, exhale, hold your breath. Inhale, exhale, hold your breath. Yes, sir. Inhale, exhale, hold your breath. Can you please inhale, exhale, inhale, exhale. Inhale, exhale, percuss the upper border of the liver. Next, please inhale, sir. Exhale, hold. Inhale, exhale, hold. Inhale, exhale, and hold. Inhale. Exhale. Hold. Sir, can you please inhale? Exhale. And hold. Inhale. Exhale. And hold. Inhale. Exhale. Hold. Inhale. Okay. Next thing to do is to percuss the spleen. Sir, can you face to the side?
Check the picture kung asan tutoy. Tama. Okay.
Sir, can you please come right up? Blunt percussion on the liver. Sir, can you face this way? To the right, please. Yes, you can now go back, sir. Palpation. Palpate on a non-tender abdominal quadrant. Palpate 2 times, lighter and deeper. Next step is to palpate for masses. Next is to palpate the umbilicus and its surroundings. Umbilicus.
Ikaw. Check na lang ang parang check na lang ang
Next is to palpate the aorta. Next is to palpate the liver. Sir, can you please inhale? Exhale. Hold. Okay. Sir, can you please face to the side? Sir, can you please inhale? Exhale. And hold. Okay, so you can now go back. Next thing to do is to palpate by hooking. Sir, can you please take a deep breath? Inhale. Exhale. Inhale. Exhale. Okay? Next thing I'm going to do is to palpate the spleen. So, sir, can you please face right? pa. Next thing I'm going to do is to palpate the kidneys. Sir, can you please lie down? Opposite. Okay, sir, you can now go back to your normal position. Next is to test for appendicitis. Sir, do you feel any pain?
No.
Sir, you feel any pain? Sir, do you feel any pain?
No.
Okay. To do is the Piso sign.
Side.
Sir, can you please face at the side? Do you feel any pain, sir?
No.
Okay.
Ito next.
Next thing I'm going to do is the augurator sign.
Tutok. Tutok. Tuyok. Okay, anything?
Do you feel any pain, sir?
No.
Okay.
Yes.
Other side?
Feel anything?
Do you feel any pain, sir?
No.
Okay, thank you.
Ako nagilok-ilok ko.
So, sir, please tell me if you feel any pain.
No. Bawa na. No. Yes. No pain.
Okay.
Okay. Okay. Yup.
I'm going to check your bladder. Is it okay to you to lower your... Okay. So, sir, can you please stand? Remove your gown, please.
Thank you. Pintura. Ang pintura mo ng t-shirt mo. I-arrange ko.
There, well.
Arrange ko. Arrange ko. No, last na. Lights. Nice.
So, sir, we're done with the assessment of your abdomen. Here is the summary of what we have just done. Okay, so upon inspection, your skin is uniform in color, no rashes, no lesions, and your umbilicus or your navel is midline and inverted, which is pretty normal. Your abdomen is symmetrical, and upon auscultation of your bowel sounds while I was listening to your abdomen, it's okay. So while I was measuring for your liver size on your liver span at your liver lagi ni. We're done with our assessment of your abdomen. Here is the summary of what you have just done today. So upon inspection your skin is uniform in color, no rashes, no lesions, and your umbilicus or your navel is midline and inverted, which is pretty normal. Your abdomen is symmetrical, and upon auscultation of your bowel sounds while I was listening to your abdomen, abdomen sounds are pretty normal, and I hear no bruise or venous hum. Okay, so while I was measuring for your liver size, your liver span is normal. at the mid-clavicular line. Here I measured it is at 7 centimeters, and while I was measuring for your liver span at the mid-external line, it is measured at 5 centimeters, which falls within the normal range. That's all, sir. Do you have any questions or clarifications?
No?
Okay, thank you. Last thing I'm going to do is to perform hand hygiene.